Hi there, today we're going to be discussing deep vein thrombosis, or DVT, and how Rivaroxaban can be used in treatment. Deep vein thrombosis is a blood clot which occurs in a deep vein of the body, most commonly in the lower leg, thigh or pelvis. It can lead to major health problems and in some cases even be fatal. DVT often arises from a history of blood clotting, having long periods of bed rest, and blood clotting disorders. It presents with symptoms such as pain and swelling in the legs, swollen and tender veins, and discoloured skin. Treatment aims at preventing the occurrence of future blood clots and avoids the complications associated with the condition. The recommended therapy for DVT are anticoagulants, including heparin and warfarin. However, we will be focusing on Rivaroxaban. Rivaroxaban is an oral anticoagulant that acts on the coagulation cascade, which is the process by which blood clotting occurs. It acts by directly binding to factor XA and competitively inhibiting the active site. This inhibition blocks the amplification of the cascade, preventing the formation of blood clots and thereby preventing DVT. Rivaroxaban is administered orally and provides an onset of action within 30 minutes, reaching a peak plasma concentration within 2 to 4 hours, and has a half-life of 5 to 13 hours depending on age. There are a variety of drugs when it comes to anticoagulants, and these are a few common ones. Dalteparin is a low molecular weight heparin, which is administered subcutaneously, making it difficult for some patients to take. It is commonly prescribed due to its effective nature and predictable response. However, it does present contradictions for patients with renal failure. An alternative choice is warfarin, which is an oral anticoagulant, allowing for an easier route of administration, but has a slower onset, meaning results are not seen immediately. Warfarin is associated with serious adverse reactions, such as severe bleeding, and is not advised for patients who are pregnant. In comparison to these widely used drugs, Rivaroxaban seems to be the perfect combination. As stated earlier, it is an oral anticoagulant which provides a rapid onset. However, it has a shorter half-life and therefore requires dosing to maintain therapeutic levels, presenting an obstacle for patient compliance. With relation to the most advised product, for prophylaxis, the recommended drug is a low molecular weight heparin, such as Dalteparin, whereas the recommended treatment for DVT is a low molecular weight heparin followed by an oral anticoagulant, commonly warfarin. However, a guideline study conducted earlier this year did recommend low-dose direct oral anticoagulants, such as Rivaroxaban, in preference to warfarin for extended coagulation therapy. It is important to look at the hierarchy of evidence when evaluating clinical trials to assess the quality and strength of research outcomes. A randomized non-inferior study conducted by the Einstein investigators in 2010 compared the treatment of acute DVT when using Rivaroxaban and enoxaparin with a vitamin K agonist such as warfarin. These studies showed that Rivaroxaban was just as efficient in treating acute DVT and was very successful in long-term prophylaxis, reducing adverse reactions by up to 50%. Being a randomized controlled trial, these studies present level 2 evidence and therefore have a large clinical impact. A randomized phase 2 trial aimed at exploring the efficacy and safety of Rivaroxaban at varying doses. It found that Rivaroxaban has a high efficacy of safety and at 20 mg daily is an optimal dose for patients with established DVT. The study eliminated bias by including a blind double parallel group comparison with an adjudication committee blinded to the treatment allocation. Being level 2 evidence, this study has a strong clinical relevance applicable to the treatment of DVT. Rivaroxaban has been proven to be an effective alternative to traditional anticoagulants for reducing the risk of stroke in patients with non-valvular arterial fibrillation and for the treatment of DVT and pulmonary embolism. In multiple clinical trials, Rivaroxaban was associated with lower rates of major bleeding events, thereby reducing hospitalization costs and proving itself as an economically superior option. Despite prior concerns about lacking an antidote for bleeding events, in 2018 the FDA approved the drug Andexxa as one which can reverse the effects of Rivaroxaban. To conclude, Rivaroxaban can offer a more convenient, safe, and cost-effective way of treating thrombotic conditions, in particular deep vein thrombosis.